film demonstrates and describes the guidelines for pediatric basic life support. Responders who have been taught adult basic life support and have no specific knowledge of pediatric resuscitation should use the adult sequence. The following modifications to the adult sequence will, however, make it more suitable for use on children. Firstly, and more importantly, make sure that you and the child are safe and remove any possible hazards such as toys, glass or electric wires. Check the child for a response by gently tapping his shoulders and speaking to him. If the child does not respond, immediately shout for help. Open the airway by putting one hand on their forehead and gently tilting his head back. At the same time, lift the chin by placing 2 fingers on the point of the chin, taking care not to push soft tissues under the chin as this may block the airway. Keeping the airway open, look, listen and feel for normal breathing by putting your face close to the child's face and looking along the chest. Look for chest movement. Listen at the child's mouth for breath sounds and feel for breath on your cheek. Look, listen and feel for no more than 10 seconds to determine if the child is breathing normally. If the child is breathing normally, turn him onto his side into the recovery position. Call for an ambulance, and while waiting for the ambulance, continue to check the child's breathing. If the child is not breathing normally or making infrequent irregular breaths, immediately ask someone to call 999 or 112 for an ambulance. If you are alone, perform CPR for 1 minute and then call for an ambulance yourself. Continue CPR while waiting for help. To do this, check and clear for obvious obstructions to the airway and give 5 initial rescue breaths. Open the airway by tilting the head back and lifting the chin. Pinch the soft part of his nose. Allow his mouth to open, but maintain an open airway. Take a breath and place your lips around his mouth, making sure that you have a good seal. Blow gently into the child's mouth. As the chest rises, stop blowing and allow the chest to fall. Repeat the process 5 times. If the child is still not breathing normally, following the 5 initial rescue breaths, perform 30 chest compressions immediately. Place the heel of one hand in the center of the child's chest. Lift the fingers to ensure that pressure is not applied over the child's ribs. Position yourself vertically above the child's chest and with your arms straight, push down approximately 1/3 of the depth of the child's chest. After each compression, release all the pressure on the chest without losing contact between your hand and the chest. Repeat 30 compressions at a rate of 100 times a minute, which is a little less than 2 compressions a second. Compression and release should take an equal amount of time. Following the chest compressions, give a further 2 rescue breaths. It is vital to get help as quickly as possible when a child collapses. If alone, perform CPR for 1 minute before getting help. If possible, take your child to the telephone and dial 999 or 112 for an ambulance. Return your hands without delay to the correct position on the chest and give a further 30 chest compressions followed by 2 breaths. Continue with chest compressions and rescue breaths at a ratio of 30:2. Only stop to recheck the child if he starts breathing normally. Otherwise, do not interrupt resuscitation. If your rescue breaths do not make the chest rise as in normal breathing, then before your next attempt, Check the child's mouth and remove any visible obstruction. Recheck that there is adequate head tilt and chin lift. Do not attempt more than 2 breaths each time before returning to chest compressions. If you have help, continue CPR for 2 minutes. Then the second person takes over. This is to prevent fatigue, but ensure the minimum of delay during the changeover of responders. Continue to change over every 2 minutes. Chest compression only CPR. If you are not able or are unwilling to give rescue breaths, give chest compressions only. If chest compressions only are given, these should be continuous at a rate of 100 a minute. Stop to recheck the child only if he starts breathing normally. Otherwise, do not interrupt resuscitation. Continue resuscitation until qualified help arrives and takes over. The child starts breathing normally, or you become too exhausted to continue.